Welcome to Community Voices with your host, Terrence Lachey. This radio roundtable features community, business, and religious leaders that discuss current events and topics that impact our urban community. If you would like to be a guest or if you have a suggested topic, contact the station today at 616-259-7342. Now, into the program.
Greetings and welcome back. I'm Terrence Lachey, and you're tuned in to another edition of 91.9 FM, The People's Choice Community Voices. I'm excited to have this conversation today because it's kind of bittersweet, but it's some valuable information as well as an opportunity to look back over some health issues, some things that pertinent to the entire community, and something that we all experienced. I've got a great guest here, Dr. Grifka from the U of M West, Health West. You are currently the president. But during 2020, during the pandemic period of time, I was talking to somebody the other day, and I said, "Do you remember the pandemic era?" And they go, "Yeah, that was about 5 years ago." But Dr. Griffith, thank you for being here and allowing me to have this opportunity to interview and talk to you.
Well, thank you, Terrence. It is a pleasure to be here. And you're right, it has been 5 years. Hard to believe.
Yeah, that
5 years have passed since then. Yeah. At that time, I was the chief medical officer.
Absolutely.
Who oversaw the hospital operations.
For the duration, from what they tell me,
Yes.
for the duration of that. So thank you for your service.
Well, we had a lot of great people helping us make it through that, that's for sure.
Yeah. That experience, I'm sure, had to be, well, it definitely impacted the entire world, but it had to be something that personally impacted you and all of your years of schooling and all of your medical and professional training. Never anticipated that you'd be kind of at the helm steering a facility such as this or an organization as large as this during a pandemic. What was that like?
It was a bit ominous. Obviously, you go through many years of schooling, education, learning, and you've got to, and having done this for a few years, I think I had a pretty good handle on how to manage patients and take care of the hospital. But that was a whole new experience.
Absolutely.
There was just no way we could have been prepared for that, nor anyone could have been prepared for that.
Sure.
Every day was a new experience. There were changes to policies, sometimes more than once a day.
Oh, wow.
And our goal was obviously to take care of patients, but one of our other goals was make sure our staff was safe.
Sure. And then you were following protocols and
exactly,
things like
and
that.
making sure they were putting their self at risk, taking care of COVID patients, and wanted to make sure we provided them as much safety as they could, so then they could in turn take care for our community.
Sure. Information was just day by day, like you said. I served during that time on a faith-based county commission to link churches to all of the resources and the services. And there were people from U of M Health West that were on the call as well. And we were getting constant updates. And oftentimes it was quite grim. Numbers were, climbing every day. What was it like just in your mind to have to experience all of that carnage, as we would say, but then at the same time fight toward victories? Because I think we won. I think so far. I mean, you're the professional.
No, you're well, thank you. It was, as you said, there were many new challenges you had not come across before. Wanting to make sure you support your staff in addition to the patients in the community. Mm-hmm. We certainly wanted to do everything we could for everyone, and there were some limitations what we could do. So trying to decide, triage how best to manage patients, how quickly to manage patients, and even different ways to treat patients. Do you put them on the breathing machine? Do you put them on their tummy to try to not keep them off the breathing machine? Many hospitals had their own different protocols, and we didn't have the usual rigorous testing where we'd compare one treatment to another.
Right.
To see that's how we do most of our medical therapies, and with just different testing protocol and then review by our colleagues from outside our institution. We didn't have that. So in some ways we were, I hate to use the term flying by the seat of our pants.
Or trial and error.
Yes, but nonetheless there was, and it was also a time when many times our healthcare systems were in a competitive mode.
Absolutely.
Now, having said that, it was one time where it was safe to say, the three healthcare systems in Grand Rapids and obviously elsewhere, we actually were in a collegial mode. We needed, finding personal protective equipment.
Sure.
As we also learned
So
the
you
term
collaborated.
PPE was something we had never heard of before, really,
Exactly.
that acronym. But now we learned what that meant quite quickly. But
Sure.
you were trying to get gloves or masks, and a lot of the masks came from outside countries. Well, they didn't want to export them because they needed them for their country.
Yeah.
So if we
remember
found a source, we would, when we were talking with our colleagues at the other hospitals, but hey, we found this, and you may be able to get some equipment from them. So you're working together. Or hey, we've got a huge load. We weren't expecting this much. We can send you a third.
Sure.
And we've got something we can help each other. So I think we took the mentality. We're all in this together. We're maybe in different buildings, but we need to keep each other safe because that's the best thing for all of us.
Sure. At that time, we were all fighting the same enemy. I can remember
right.
coming back. I was on an international trip and came back a day before the actual shutdown when we became quarantined citizens, or what they say, shelter in place, right?
Yes.
And it was just a very surreal experience to see empty streets, or the grocery store had very little on the shelves, and people had this look of fear behind those masks. And we learned a lot during that time. What was one of your greatest lessons as a professional, but just as a human citizen? What did you learn through that?
I think number one, as you said, we're all in this together.
Yeah.
Both the patients and the staff. We all have people to take care of. We all have families to take care of. And how do we do that best for each other? I think there was a lot of collegial relationships. Patients were very thankful for everything that you did. And there was that phrase where, we were the heroes.
Yeah.
The healthcare providers were the heroes. And we were doing everything we could to take care of them. And, having to have people where patients couldn't see their families. You could try to set up Zoom calls or iPads so that they could at least interact, at least see their family, talk to their family, make some communication with them.
Sure.
They may not see them in person, but we could get that personal touch.
Yeah.
Was really important, and it really helped us become more, I think, humane.
I can honestly say that here at U of M West, the protocols were in place because as a clergy person, I had to do some visits, and I guess there were very limited
Yes.
access points, whether it's clergy, just one person next of kin. But I remember the masks, I remember all the protocols, and I think it was a sense of calm here. I guess in some larger urban cities, there might have been a lot of chaos.
Yeah, I think we did a nice job of trying to get personal protective equipment for visitors, for clergy, for if a patient is doing poorly.
I felt safe.
Let's get a family member in so they can connect with the patient. And it was just kind of stretching some of the guidelines or regulations, but we wanted to make sure, again, that interpersonal relationship was important, and that personal touch with your family is really crucial. And that was a good medicine in and of itself for many patients.
Yeah, I can say for sure it was definitely calming to be in a space where there was a lot of fear, and people were probably reacting out of instinct a lot of times with regulations and protective measures, and even some people took it upon themselves to be even more protective.
Yes.
Whether they were working the front door security or whatever. And I think that we learned a whole lot. Think about it. 2020 was the time frame. What stood out in those early days of the pandemic for you? The early days, because 2020, we're in 2025. People could easily forget. What stood out at the onset for you?
I think the looking in people's eyes, both the staff and the patients, and the fear of the unknown that just struck every day.
Yeah.
And as we went into I guess it was the first winter really of December of 2020 and January of 2021, we have a daily safety brief every morning at 8:30, where all of our nurse managers and physician managers and technicians and hospital leaders get together for about 15 to 20 minutes. We discuss what's going well, what isn't going well, talking about your floor, your unit, what challenges you may have, or if nothing is a problem, great. But if there is a problem, there are many people can address the problem immediately. I attend those every day. And I remember in January of 2020, coming to the during the Delta and Omicron, remember those variants?
When the variants started
exactly.
popping up.
I guess it had been 2021. But I remember walking into a conference room at 8:29, thinking, I have nothing good to say.
Wow.
Anything I could have come up with that was positive to help the troops, to reinforce our collegiality and teamwork, I was blank.
Wow.
So it just hit me that, okay, you've got about 40 seconds
Yeah.
to come up with something.
Yeah.
Because they're expecting to hear it, they want to hear it, and they need to hear something.
Sure. And people are
yes,
persuaded by the
yes,
first 20 seconds
yes.
of whatever it is that you have to say.
But that really hit me like and how long is this going to go on? We didn't know. And I remember the first time somebody asked me, about 2 or 3 weeks after the pandemic, they said, how long do you think this will last? I said, well, probably till May or June. 2020.
Yeah, yeah.
Little did I know, nor anyone else, that
Yeah.
it was going to be really 2 more years. But I think just looking into people and seeing the fear in their eyes
Yeah.
and saying, okay, I need to help them feel a little more comfortable, a little safer.
Sure.
How do we do that? I remember, and some of the comments were, there were now meetings with leaders staying at home and participating in Zoom. We all learned about Zoom and
Everything.
Teams and
Yeah.
things. Yeah.
We didn't even know Zoom existed.
And
to that
some of the
extent.
comments, well, gosh, it's great to be able to stay at home and join a Zoom call. I'm here with the patients, putting myself at risk right at the front lines. So I kind of decided, okay, I'm going to come in every day.
Yeah.
If they're doing it, I'm going to do it too. And I worked 101 days right straight.
Wow.
Just remember, but I tell you, what that did for the team.
Oh, it absolutely.
And I was in there with them, and I'm not trying to hit myself sound
that explains
special,
things.
but it's really, that's what, having a little bit of that connection to each other and the continuity really made the whole team say, hey, we're in this together, we're going to take care of each other.
I was going to say that explains the spirit of how we made it through. Just that spirit alone, with that attitude. As a doctor who's taken the Hippocratic Oath, you have a passion, I think, and I'm looking here, pediatric cardiology. Talk about your beginning years that you didn't know was going to prepare you for even the current role that you have now as president, but navigating that space. Your early years. Pediatrics is your thing now?
I'm one of 6 kids. My younger brother had Down syndrome.
Okay.
And a special needs kid, wonderful kid. But I always learned from his care that the physicians could have done a little better job for my brother and my parents.
Okay.
So I think I can do better than that. So I kind of worked diligently, and I think other people can decide if I've achieved that or not. But
Obviously,
I've always tried to
You're the chief,
be a
literally.
little better than they could have. And I think when you have that mentality and you work with people and you treat them as equals, treat them as peers,
Sure.
And you relate to people at their level. And no one wants to be sick. No one wants to be at a hospital.
Right.
No one wants to have COVID and talk about ventilators and things. But you need to connect with them at their level and respect their education, their values, and their situation.
Yeah.
And as I said, everyone would rather be home.
Yeah.
But how do you do your best to relate to them in that very challenging time?
So your life experiences gave you this motivation to go into cardiology or into pediatrics because of your little brother. Off the air, we were talking a little bit about being both from the hometown of Detroit, Michigan, and go Tigers, go Pistons, go Lions, all things Detroit. Or I bought my wife this shirt that says Detroit versus everybody.
There you go.
So we stick together. Talk to me a little bit about your motivation as a kid. You were sharing that U of M wasn't exactly the place that you landed, but you did obviously accomplish quite a lot to be in the position that you're in right now and the work that you have accomplished. I hear a lot of heart there. I hear a lot of heart, no pun intended, but I hear a lot of heart.
I've been very blessed. I've had a lot of very good mentors.
Great.
And they certainly, I was quite fortunate. Many of them pushed you to be better every day. In fact, when I was training down in Houston, the first thing they said to me the first day I was at Texas Children's Hospital, they said, what are you going to do to make us better today? And the next day, what are you going to make us better today?
Yeah.
And the third day. And after a week or two of hearing that, you start getting to the point where when you come to work, you're thinking, okay, what am I going to do to make us better?
Better today.
And imagine if the whole hospital team is driving to work with that mentality.
Yeah.
Boy, you get there and great things can happen.
Yeah. I think in life it'll make the whole
Absolutely.
world a
No,
better
you're right.
place.
And it's, we try to, I think we're working with that here, and we've got a great team, and we're looking every day, how do we get better?
Yeah.
And I think we've got a great team here, very collegial. The culture that we have here is great. We've got some of our staff, their parents worked here, some of them, their grandparents worked here.
Yeah.
So in keeping that culture at U of M Health West is important. We've had a lot of growth, but I'm fortunate to say we've kept the really great culture, great working collegial relationship amongst our staff, and that's hard to do.
Yeah. Well, that kind of leads me into the next question that I was going to ask about how the COVID-19 pandemic permanently changed the way that U of M Health West provides patient care. How am I going to make the world a better place? Sounds like a mantra,
Right.
but in addition to that, how has COVID changed?
It taught us some valuable lessons. You need to be adaptable, you need to be flexible, you need to be innovative. I know some of the things we came up with. We actually, when we were running out of N95 masks, if you remember that term,
Oh, yeah.
we actually came up with a way to re-sterilize them safely.
Oh, wow.
So we wanted to make sure our staff would have masks for them. We certainly came up with other ways to transport patients. We came up with ways to get visitors in so they could see patients, but yet still keep our staff safe.
Yeah.
And I think listening to them, listening to them is important. Sometimes the people with the boots on the ground have the solution to the problem.
I like that.
So go
Boots on
listen
the
to
ground have the
go listen to them.
solutions, yeah.
And if there's one thing I learned, if you round on a Saturday or a Sunday or in an evening shift, you can learn an awful lot. The healthcare just doesn't exist between 9 and 5.
Right.
And the people at nights and weekends and holidays, they're important, and they've got some great ideas and thoughts. And boy, it's it's a little different pace.
Sure. And well, typically that's when patients have the hardest time is during the night hours.
Exactly.
Yeah.
And being there, talking to the staff, and even talking to some patients too. I think one of my favorite quotes is from Helen Keller. Worse than being blind is having sight but no vision.
Wow. That's profound.
But isn't it? I mean, really, listen and hear, because a lot of times the answers are right around you from people that you work with, and you just need to listen to them.
Well, it sounds like you have a holistic approach to listening to those who provide the service, those who need the service, those who supervise and lead those who are providing the service, and that's a big picture. That's a huge picture.
Well, Terrence, I'm not that talented. I need to have a good team around me, and fortunately,
That's humility at its finest. I think we all do. When we recognize that we're not the answer,
Right, yes.
we're part of the answer.
Right. No, so it's, again, getting a great team, giving them rein to do what they need to do, what they're good at,
Yeah.
and listening to them, learning from them, and working together. One and one becomes three, and that's where you really, and again, if you're keeping the patient as your primary focus, good things happen.
Sure. Well, COVID taught us a lot. There were quite a few things that were innovated as a result of us having to provide a solution. Like you mentioned, the discovery of how to resanitize or sterilize the masks. Those were profound innovations, and I think that necessity is the mother of invention.
Certainly.
Yeah, you probably discovered a lot of things. What steps have been taken since the pandemic to ensure the hospital is better prepared for future health crises?
Well, certainly, it's an interesting, we talk about personal protective equipment. Prior to COVID, with all of the fancy overnight delivery systems we had, our supply, we only kept 3 or 4 days of supplies on hand.
Right.
That way you don't have to, the hand sanitizer is flammable, so we didn't have too much. But all of a sudden, 3 or 4 days isn't going to be good. So
Right.
we've expanded our supply chain and our supplies just in general, so we've got a longer supply if something does disrupt, be it a earthquake or a hurricane. As we learned with the IV fluids just a few months ago. So we've expanded our supply chain. Certainly, one thing which has been profoundly accelerated because of COVID was telemedicine, televisits. Many
people's ability to
be
get
seen by physicians.
Yeah.
It's a little quicker and easier to see a patient with telemedicine. There are some visits that are very well managed by that. Others still need to be seen in person.
Yeah.
And we learned, okay, these illnesses or concerns can be addressed very well with telemedicine. The patient doesn't have to leave either their work or their home, and we can see them a bit more easily, get them in and out for their care. So
That's an example of the
absolutely,
necessity
yes.
being the mother of invention.
and we're much better off because of it. Having said that, I think we all have learned that there was some concern. Oh, all of our medicines can be by telemedicine. No, that's not true.
Well, you epitomize what it means to actually have a heart for people and want to look them in the face. And I think patients expect that as well from their physicians and from their doctors or caregivers. I had my first physical exam through telehealth during the COVID period, and it was strange to me. It was just kind of weird, because you're used to being able to make yourself transparent, literally, in the presence of a physician. How are we prepared for the future with that? I know that's a mechanism, but how are we prepared here at UFM West?
It's interesting. And telemedicine can, as I said, many things can be handled very nicely, efficiently, and easily with telemedicine. There's some things that you pick up just in person to person. A person's mannerisms. Are they looking at you in the eye? Are they looking down? There's indirect, nonverbal communication that you might not get as effectively with telemedicine. In fact, I think maybe some of our physicians and nurses in training, they may not have learned that skill real well yet. because
That's true.
they didn't have.
And that's what we call it practice. So in essence, you're saying then that you've learned how to integrate both the telemedicine as well as keeping that human touch, that human element.
And I think we probably, some areas were a little better than others. But as we move forward, I think making sure we refine both. I mean, a case example, there was a patient who wanted is a simple visit, and we're going to do telemedicine. And they said, no, I want to be in person, I want to be seen in person. So we finally scheduled an in-person visit. It took a couple more months. Very simple problem, addressed it easily, could have been done by telemedicine. We found a little spot on his arm that we might not have found
That
by
was unrelated
telemedicine.
to that
Unrelated,
particular- yeah.
and of course, that wound up being melanoma.
Right.
So
You're able to capture that
exactly.
early.
So then that obviously that was important. So we've got, as with anything, all the glitters isn't gold, and not everything's a perfect cure.
Yeah.
But how we incorporate that into our daily care is going to be, I think, will determine how successful we'll be. And we need to fit in as much as we can, but yet there are times when that direct personal touch is really important in physical exams. So we'll keep working on refining it. Are we better? Absolutely.
Yeah.
Are we perfect? We've got some work to
Still
do
working
still.
on it, yeah.
Absolutely.
Well, honestly, just listening to you, it builds my confidence that West Michigan, this greater West Michigan area, is well covered with the services that you provide here. I like to keep the interviews and discussions really, really personal so that people can relate. You've got family, you grew up in a family. What stands out to you the most about moving forward in what we may face when you start thinking about the impending things? There's a measles case here in Michigan now. That could be the next pandemic. Just your thoughts, and I'm not looking for any type of professional
It's
advice,
interesting.
but
Something else we learned from COVID, when COVID started, no hospital had any testing material for it.
correct.
And nobody has. So every test had to be sent out.
Yeah,
And of course, every hospital, we found the best lab or the quickest lab.
third party though.
Well, eventually, that third-party lab became swamped. So, okay, now we need Plan B.
Yeah,
And then, okay, now we can get these tests. Well, how many tests can you get? Well, there's a new test coming out every week
Yeah.
from a different company.
Yep.
Well, this test is better. Well, should I wait one more week for the next best test? Or should I take this one?
and then getting people to want to go and get tested. That was the other thing too, to avoid
Well,
the spread.
and it's interesting, once we finally had tests here at the hospital, we had supplies, were limited. We had like 20 tests per day. So for our whole health system, we had 20. So it got to, for the first like 3 or 4 months, every test we did, I had to approve it.
Wow.
I mean, if someone is not ill, but they have some mild symptoms, well, let's not test them. Let's test,
Right.
this other
Somebody who
person who's
has-
actually having some symptoms, and we really need this. They're going to need some treatment, whereas this person may have a little cough and is fine. Boy, that was in and of itself, and put yourself in that position. It's like, boy, I mean, I have to decide who's going to get tested and who isn't.
Yeah.
It's a good responsibility, and it's just it is a bit challenging.
And
Oh,
you
very
might
much
have-
so.
And you've got opposition of thought from colleagues.
Absolutely.
So while you're
Right.
building that team of collegial, we can get along,
Yes.
you still have people with different thoughts. The hospital itself, the entire U of M West, how can people interface with the hospital? Is there a website or some information that?
We've got ufmhealthwest.org. You can go to the University of Michigan, Michigan Medicine, but yeah, easily to find us. Obviously we were known as Metro Hospital for a number of years.
Sure.
Now at ufmhealthwest.org, you can find us, but I'm happy to say we've got some great people who work here.
Yeah, I was going to say, what's the span? Well, it's the entire county, of course, but
Well, we've got about 22 outpatient offices, clinic offices, in addition to our hospital here. We have an urgent care center and outpatient surgery center in Cascade. But we cover the broad part of both Kent and Allegan County, Kent and Ottawa counties. So we're very happy to be in several communities. But again, we're doing all we can. We participate in many community events.
Yeah.
So we find it important. We want to be an important part of our community.
absolutely. I've had a chance to interview a few people from the staff, and always upbeat, very well-informed, and happy to work here, happy to be a part.
And again, it goes back to the culture, and I think because people do like working here and like working with each other here, the patients see that, they feel that, and not that anybody really wants to be in a hospital.
Right.
But I think if
But
they
if I
are-
had my choice.
Exactly, and they like it when, the person taking them in the stretcher to X-ray is pleasant and respects
Sure.
them and talks to them.
And recognizes
and knows them from the previous day. The person brings their food is collegial, and let me warm that up for you. I mean, those little things Little things make a big difference. And as I said, no one wants to be here, but however we can do to relieve some of their pressure, some of their suffering, and obviously do the best medicine we can. Those things all add up, and they're all important.
Yeah. I think University of Michigan Health West is an example of hospitality in the services that's being provided in healthcare. I think it's important for us to be able to make those connections. Are there specialty areas or clinics that right now you would like to kind of shout out? Or
Sure. Now, we've got, but we since the affiliation with the University of Michigan, going back to December of 2016, since that time we have started about 26 new programs, believe it or not.
Nice. What are some of those programs?
Certainly, we've got thoracic surgery, cardiac surgery, stroke. We have advanced neurosurgery, orthopedic surgery. Cancer is a big thing. Another nice example of collegiality. We really wanted to advance cancer care for West Michigan.
Right.
And we've got a great team here, but it wasn't, a huge patient volume. So we are working collegially with Trinity Grand Rapids.
Oh, okay.
St. Mary's before. We've got a combined cancer program with them.
Nice. That's probably unheard of in other parts of the country.
It's, we're working collegially.
With your competitor.
No, you're right. But it's because of that, now we're combining our teams, combining our resources. And because of that, we can provide a bigger program, which is easier to recruit physicians and nurses and staff to. So they've got more patients, and they can really focus on what they can do. So we'll have enough patients so we can have a physician and nurse physician team who focuses on breast cancer, who focuses on brain cancer, focuses on melanoma, focuses on colon cancer, prostate. If we did it separately, we wouldn't really have enough volume to attract really high-quality physician, nurses, and staff.
Exactly.
Same with cardiovascular. We're working with Trinity on a cardiovascular program.
Yeah. I think that's how the station originally started connecting with the hospital, was through the cardiovascular program more than 10 years ago or sometime?
Actually, cardiac surgery started about 2.5 years ago.
Oh, 2.5 years ago.
And interesting, we predicted we would do about 50 surgeries the first year. We did 122.
Great. I know there's a really good relationship that
Yes.
the station has with the hospital, and it'll continue, I'm sure. I've enjoyed this conversation. Let's take the last few moments, give you an opportunity to just talk to the audience. Perhaps words of encouragement, maybe even a perspective. 2020 was the COVID pandemic. We're in 2025. What are words of inspiration that we can hold on to?
Well, thank you. Obviously, there's a lot of challenges ahead of us.
Yeah.
Medicine's a little different situation. Obviously, there's going to be some changes from Washington that we're seeing. But nonetheless, please be known that your healthcare providers are here for you. We're going to do everything we can to take care of as many people as we can with the highest quality that we can. We're under stress too, so give us some grace. But nonetheless, we certainly want to take care of everyone that we can, and there's advances occurring. We look forward to providing these advances, and it would make us happy if this hospital was empty.
Right.
But until we get to that
I know what
point,
you're saying.
until we get to that point, we're going to do everything we can.
Work yourselves out of a job.
Exactly. Everything to take care of our community, and again, we're here for them. We appreciate that they trust coming here. We appreciate their physicians trusting their patients to us for care. But we need to earn our stripes every day, and we're going to continue to do so. And if we're not, let us know. But we certainly want to be, we know we're not going to be the biggest healthcare system, but that's okay. We're going to be the best.
I like that. Well, thank you so much, Dr. Grifka. It's been a pleasure talking to you and having just some talk down memory lane of what COVID 2020 was like. It's called COVID-19, but it was 2020
it was,
that we
right.
experienced it. And now that we're on the other side of that, I'm sure you're doing everything that you know as the president here at U of M West to make sure that we're ready for whatever's next.
And we'll be ready for that with them. And again, Terrence, thank you for your time, and thank you for what you do for our community also.
Great, thank you. You've been listening to another edition of Community Voices with Dr. Terrence Lachey here on 91.9 FM, The People's Choice.
Been
Thanks for tuning
listening
in.
to Community Voices with your host, Terrence Lachey. Community Voices can be heard every Friday at 12 noon. This radio roundtable features community, business, and religious leaders that discuss current events and topics that impact our urban community. If you would like to be a guest, or if you have a suggested topic, contact the station today at 616-259-7342. Until next week, let your voice be heard in the community.